Hey guys, welcome back to PW Medal YouTube channel once again. So there are lots of students who are in the second, third year and final year who wants to focus on different exams, different competitive exams, be it NEET PG or be it to sit in AIMS, Delhi's, other AIMS and INI or be it in FMGE exams. All these three are competitive exams with its own advantages, disadvantages, with its own strengths and weaknesses. So what we are going to do here is, if you're a student in the medical school, whichever part of the world you are, and if you're going to attempt these exams, what to focus and how to ace them is what I'm going to talk in the next 5 minutes. So if you are someone who's interested in this, keep listening to more and clicking the follow button. We'll learn more about medicine, pathology and the entire thing as a whole. So first we'll take about the NEET PG. For most of the students who appear for NEET PG or most of the Indian medical students who graduate who appear for NEET PG to stepping stone for MD or MS, INI is definitely a crown, but most of the students feel that INI is not for me, which is not true. We'll be discussing that in subsequent videos. So if you're an Indian student, if you're targeting these two exams, what to focus for NEET PG, what to focus for INI. NEET PG primarily over the period of years has evolved to a more of a scenario based exams, more of integration. Even if you take a question in pathology, there's a patient coming there with a swelling, then a biopsy, then a marker. So there, I would say honestly, there's a very big change which has almost reduced the division of subjects. I cannot at this point I'm saying that this question is from pathology, because there will be a surgical input, there will be a medical input also. At the same time, you can't say this is a question of medicine. There will be a pharmacological input, there will be a pathology input, there will be a clinical input also, right? So the distinction between subjects is blurring in NEET PG. So what do? That's where your CBME curriculum comes to place. CBME curriculum is an integrated curriculum. It's not about reading anatomy. It's about reading the relevance of anatomy in clinical medicine like surgery or medicine or pathology or your orthopedics, right? So when you are very strong in your MBBS, the 4 years of MBBS lays down an amazing foundation for NEET PG, because most of the questions here are integrated. There's no question saying that it's coming from pure pathology, it's coming from pure anatomy. There will be there, but the majority of them are going to be integrated fashion. So the base here should be based on MBBS. If your MBBS is good enough, by default, the NEET PG is not going to be a difficult exam to crack. On the other hand, when you look at INI, INI has always had this equation, right? 60-40. 60% of the questions are more focused on first and second year. Though sometimes this might be a little bit blurred, but even if you take the last 10 INIs, majority of them, 60% questions comes from the basic sciences. They always retain that. So if you are someone who's very much focused on INI, please don't go lit of anat, physio, pharmacology, biochemistry, pathology and microbiology. It has to be there. 60% of them is targeting that, and this is stayed very consistent. So for INI, I'm not saying that ignore third and final year, more focus on first and second year, because majority of the question comes there. As opposed to NEET PG, there's not like that. It is more of an equal balance. Sometimes, like I said, you can't even find a clear distinction, right? So now, if a scenario based question important, most of the exams these days, be it NEET PG, INI or FMG, is purely scenario based. But INI had sometimes bounces of MCQs which are purely one-liners. If you take as a whole last 5-10 years of paper, INI unfortunately has more one-liners, like what's this new mutation? What's this new drug? INI has them a little bit more compared to NEET PG. NEET PG and FMG, both of them are conducted by NBE, has more of scenario based question, but INI sometimes throws bouncers. Should I be worried about that? Ideally no, because I cannot be prepared for a bouncer, right? So what I do is, the previous bouncers and the PYQs, I read them. I can't know that what monoclonal antibody will come in the next exam, because there are millions of them produced every year, right? So this bouncers will be something which you have to focus on. Facts still may sometimes play a major role in INI, not that much in NEET PG. NEET PG, like I said, it's more of an integrated clinical scenario solving questions, right? On the other hand, when it comes to FMGE, what has happened is, over the past few years, especially this FMGE, it's almost mimicking or very close to NEET PG. I would say the major difference in FMGE and NEET PG exam is, there's no negative marking in FMGE and there's negative marking in NEET PG. That's what I would say, right? So FMGE, since it's also conducted by NBE, there is almost very similar to NEET PG. I'm not saying it's exactly the same, but it's almost similar to NEET PG is what I would suggest. And FMGE exam has few major subjects, because the distribution, though the questions might be same, the distributions of exam patterns a little bit different in FMGE. There are subjects which you can never ignore in FMGE, right? Though last FMG exam didn't have much of OBG, but this time it is purely OBG, right? So if you consider these four, right? Medicine, surgery, OBG and PSM will contribute to more than 150 questions in the exam. So if you're a student who's in second year, listening abroad, third year, starting to prepare for FMG, these four are the gold mines. Scenario based question, the question how it's going to come will be the same like NEET PG. So please don't leave the NEET PG PIQ, solve them as well. But please concentrate on these four. These four will give you an edge, will make you very comfortable. Then let's target for 200 plus. Don't leave anything, but these four should be must. Complete this, then target for 200 plus by completing other subjects as well, right? This is a uniform take for NEET PG, FMG and INICET. If you still have any more comments specific to any particular targeted exam, put in the comment section below. I'll be more than happy to answer you guys. Thank you.